Imagine a hardworking dairy cow, calmly chewing her cud, producing liters of milk each day. Suddenly, she goes off feed, stands with an arched back, and her milk yield plummets. What could be wrong? Beneath this quiet exterior, a deadly piece of metal, a sharp nail or wire fragment, might be piercing her stomach wall, threatening her life. This condition is known as traumatic reticulitis, or more commonly, wire disease, and it's more common than most dairy farmers think. Dairy cattle, being indiscriminate grazers, often ingest metallic objects unintentionally mixed with silage or hay. Once inside the reticulum, these objects can cause devastating internal injuries. Let's explore how this condition develops, how to spot it, and most importantly, how to prevent it, saving your cattle from unnecessary suffering and your farm from economic loss. Cattle don't pick and choose their food like humans do. When metal scraps, such as bits of wire, nails, or sharp metal shards, are accidentally mixed with feed, cattle can ingest them. These heavy objects settle in the reticulum, where rhythmic contractions may drive them through the stomach wall. Complications may include local peritonitis, pericarditis, liver abscesses, or damage to nearby organs. Early recognition is key. Signs may include a drop in milk yield and feed intake, an arched back, reluctance to move, and signs of pain, depression and dullness, reduced rumination, and dry or scanty dung, rapid heart rate, and labored breathing in severe cases. Blood tests may show increased fibrinogen and white blood cells. Simple field tests like the Withers pinch test or grunt test can help identify pain in the reticular area. Metal detectors or radiographs can confirm metallic foreign bodies in the reticulum. Ultrasound is useful to detect fluid or signs of pericarditis. Ruminotomy may be needed for definitive diagnosis and treatment. Treatment depends on the severity. A conservative approach should be consulted with the support of a veterinarian, including oral rumen magnet to trap the metal object, antibiotics to control infection, anti-inflammatory drugs to reduce pain and inflammation, and confinement to reduce movement and risk of further penetration. Surgical intervention, or ruminotomy, should also be consulted with the support of a veterinarian for removal of the foreign object from the reticulum, reserved for severe or non-responsive cases. Prevention is always better than cure. Use rumen magnets in all adult cattle, especially in high-risk environments. Install magnets in feed mills and silage choppers to catch metal debris. Keep feeding areas clean and inspect hay or silage for contamination. Conduct regular equipment maintenance to reduce metal fragment risks. Your cattle are the backbone of your livelihood. Traumatic reticulitis may be invisible from the outside, but inside it wreaks havoc. Prevention is simple, effective, and inexpensive. With good feed hygiene, routine use of magnets, and early detection, you can save lives and ensure optimal productivity. Dairy farmers must work with veterinarians hand in hand to combat this preventable disease. Don't wait for wire disease to strike. Act now to defend your herd and your bottom line.